Given that a lot of experts are saying if Omicron follows the surge it did in South Africa, it could be peaking here as early as next week and probably start declining by the end of the month, is there some concern that these tests are being provided too late when the worst is already behind us?
Well, I would say first that there's unprecedented demand. We know that right now for tests. There was in advance of the holidays for understandable reasons. People wanted to see loved ones. They wanted to ensure they tested before they saw loved ones. And we were not where we needed to be. We're still not. What we've done is try to do this as quickly as possible through an expedited, accelerated contracting process to ensure that tests are available for free to people across the country as quickly as possible. Now, at the same time, we know that online and in retail stores across the country, they are restocking shelves with tests. That is a good thing. We are continuing to open more federal testing sites, as we have done in New York and different cities that have been hardest hit across the country. And we continue to have 20,000 free sites across the country. So we're not working on one channel. We are doing it as quickly as we can to get these 500 million tests in our hands, doing it through an accelerated, expedited process. But we've also taken a number of additional steps to ensure the federal testing sites, just to note, are in New Jersey, DC, New York City, and Philadelphia. Those are some of the places, just to give you a sense, and we'll continue to build on that, which we have the capacity to do.
Given the surge that we're seeing now, is it fair to say if those free tests had been made available earlier, before the holidays, before people traveled and more contact and gatherings occurred, would we not be seeing the same numbers we're seeing today? Wouldn't it have prevented some of that spread?
I don't know that we can make a prediction of that. It's a good question to ask the doctors. Look, I would say, though, and again, reiterate, as the president said before Christmas, we were not where we needed to be. What he did do is he quadrupled our testing capacity from the summer to December. He made 50 million tests available at rural health centers and community health centers in December to expand that access. We opened these federal testing sites in December. So these were steps we took to, as quickly as possible, expedite our capacity, even in December, as the unprecedented demand was rising, and doing everything we could at an accelerated pace. Of course, we would have liked to have more in our hands earlier.
Can I
Go ahead.
follow up
Oh, go ahead.
Just tax credit question.